The November 27th meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Ansello? Here. Ms. Andrews? Here. Mr. Daniele? Here. Chairwoman Draw?
Here.
Ms. Cayley? Here. Mr. Lightfoot is excused. Mr. Michike? Dr. Quattro? Here. Mrs. Valerio?
Here. Is there anyone signed up for public forum?
There's one public forum speaker. Sister Grace Miller, please come forward to address the committee.
Hi, Grace. How are you? Hi, Grace.
Well, the county can give millions of dollars to the LPGA. What about millions for the burial committee, for the burial issue? We want to get our poor buried with dignity, and we need your help, and we're asking you to include that in your budget. We've been on this issue for 6.5 years. We're not going to give up. We're going to keep coming back and coming back until we win the issue. Now, you read in the papers where a man was found dead under the trailer in a parking lot. It was a homeless man found dead. Do you care about it? Do you wonder how this homeless man is going to be buried? Is he going to be put in a cardboard box and just buried at Awaka Cemetery with no one to care for him, no one to love him? If you would give us the money, pay for the burials of the poor, we could make sure he has a dignified Christian burial, because we have done that in the past when the county helped us. We have buried many homeless individuals and given them Christian dignified burials. We need your help to do that. And we're asking you to include that increase in your budget. We're talking about the poor of Monroe County. And we're asking you to care about our poor and to give to them. The LPGA, isn't it wonderful? Millions of dollars. But when it comes to the poor, you can't even afford to give money to the poor. It's sad. It's a sad indictment. And we know the money is there. And you know the money is there. This man that died, homeless man, it's a shame he died in our city the way he died. Homeless, uncared for. And again, I ask you, do you care? We're asking you to increase the budget for the poor so that our poor can be buried with dignity. There's a quote, whenever we believe that the dead are dead, and that's sometimes the attitude, and that's that, we are feeding a little death within us. So if you do not care for the poor who die and want to be buried instead of cremated, then something within you is dying, is dead. We're asking you to please increase the budget for the burials of the poor so that our poor can be buried instead of cremated, which is what they want. They cannot afford to pay almost $3,000 to be buried. We need your help, and we're pleading for your help, and we're hoping to get it.
Thank you, Sister Grace. Is there anyone else that is present at this time that who did not sign up who would like to speak? Seeing none, then at this time, I see him. I would like to invite Scott Adair, our Chief Financial Officer, to come up at this time and present the proposed 2013 Monroe County operating budget as it pertains to our Human Services Committee. Mr. Adair. You're welcome.
Expected on the last presentation of the evening, some technical difficulties. Both with the computer and with the projector. Charades would work at this point in time. You're absolutely right. Does anyone want to see transportation again? Okay, good. Great. Thank you, Chairwoman Draw, for the opportunity to present the County Executive's 2013 proposed budget to the Human Services Committee. As all of you are well aware at this point in time, the County Executive's budget is, as proposed, provides a flat property tax rate of $8.99. It provides compliance with not only the county's Taxpayer Protection Act that was passed by this body in 2007, but it also is compliant with the state's 2% property tax cap that was passed last year. The County Executive's proposed budget is broken down into 3 areas. One of them, this will be the first committee that we really get into any in-depth discussion on it, and I would assume that the other time we will talk in-depthly about this will be at the Public Hearing and Ways and Means Committee. Our operating budget is broken down into 3 segments this year. Our comparable operating budget between 2012 and 2013 is up approximately $4.8 million, or 0.6%. The new item in our operating budget is our Medicaid swap option this year. As many of you are aware, the state legislature passed a bill last year that allowed for counties to opt out of the sales tax swap, which was something that this legislative body adopted in 2007. And to our benefit, or the county's benefit, we saved approximately $30 million over that 4-year period that we were underneath that program. Well, this year the state legislature adopted a Medicaid spending cap policy that would actually reduce the county cost of Medicaid as we move forward, ultimately capping it in 2015. So this year we are proposing with this budget that this body would then opt out of the Medicaid swap that we have currently with sales tax. This would change in our budget from making a sharing payment partner appropriation of $123 million, which we've done in last year's budget, to a Medicaid expense appropriation of $183 million to provide for the capped amount of Medicaid costs under the new plan. In addition to that, our budget includes a grant portion of the budget, which this committee is actually the largest segment of the grant budget. At this particular point in time during the year, in its infancy, we are approximately 0.2% less than where we were last year. We would anticipate that a number of grants will be received and accepted by this body throughout the year, ultimately resulting in a number that will be much greater than this $171 or $172 million to provide funding for various programs throughout the county, but most specifically in the Health and Human Services area. I mentioned earlier that we were compliant with the Taxpayer Protection Act. Taxpayer Protection Act requires that the county executive present a proposed budget and adopted by this body, that the non-mandated segment of our budget is less than the CPI. As many of you are aware of, the CPI for this region for this year is 2%. Our non-mandated spending is up 1.6%, thus making us compliant with the Taxpayer Protection Act. Our mandated spending is up 8.7%. Primary driver of that, as you'll see throughout this presentation, is the inclusion of the Medicaid costs increasing above what the payment to sharing partners was in the prior year. The last area under the Taxpayer Protection Act is non-mandated user fee supported. You'll see this is up approximately 0.5% from last year. This includes activities out at our airport, our hospital, as well as our Pure Waters districts. Getting into the human services area, human services, by and large, the largest segment of our budget. $552 million worth of appropriations are included in this area. There are a number of programs underneath this. We'll highlight a few of them as we go through, but by no means will we cover all of the areas of human services this evening, or health services by that stretch. First area of appropriations provided is the Family Assistance Program. Excuse me, the Family Assistance Program appropriations are down slightly from last year by about $1 million. That's basically because what we're seeing is a decreased, and I apologize because I'm going to get this wrong right now because I've been going back and forth with this all day, a decrease in the caseload regarding family assistance. In the safety net area, what we're seeing is a decreased appropriation based on a decreased cost per case. So what we actually budgeted for in 2012 is coming in slightly less than that, and so we've used that to build our expectations for 2013. It means that the increase is no longer matching the 2012 budget. The next slide talks about the Medicaid program. Again, the largest change here, the largest change in our overall budget, $183 million of appropriations are now provided to cover the Medicaid cap. When this body elects to opt out of the swap, what we will do is file the necessary paperwork with the state. We will then go through an exercise with the Tax and Finance Department as well as the Department of Health to effectively put us underneath the cap, which will mean that our costs for the cap, basically what the state has done is said every county that accepted the cap's growth has been 3% over the years since the option came in. This year, in 2013, that growth has been reduced to 2%. Next year, that growth will be reduced to 1%. The following year, it will be flat from what that 2014 budget was, and that is what will go on in perpetuity from the state's perspective as far as the appropriation that the county needs to provide. This $183 million is the culmination of the past 4 years' 3% growth plus the 2% growth that the state is effectively putting on top of Medicaid costs for all the other counties in the state of New York. There's a small dollar amount here provided for the intergovernmental transfer to Monroe Community Hospital, which allows Monroe Community Hospital to generate some additional federal revenues for themselves to help offset their costs. This is a standard item that has been in the budget for years now. There's been rumors that this program would end at some point in time, and far and behold, the state continues to find a way to work with the federal government to be able to provide this funding. There's also a small appropriation of direct payments of Medicaid of $4 million, not changed year over year. The daycare area, appropriations are up slightly. This will provide for additional families to receive daycare in the 2013 budget. Our facilitated enrollment grant is non-existent at this point in time. The state did not provide any funding for the facilitated enrollment grant in their 2012-2013 budget. We are anticipating or hoping that the state will provide with some leftover dollars from what we're projecting in our facilitated enrollment grant to be rolled over into our 2013 appropriation as well. But at this point in time, we have no confirmation that the state will allow for that. Adolescent care and child welfare. Appropriations are down in this area, and I think as we've heard throughout the year from our human services team, led by Kelly Reed, that the cases of foster care and adoption services are down in this community as a whole because of the preventive services that we've been providing. That has allowed us to lower the appropriation. Here, we do not necessarily perceive the need from a case standpoint to provide funding if those cases are not going to materialize. Purchase of services, as we've talked about extensively before, is a variety of contracts that County Department of Human Services goes through with various not-for-profit agencies throughout the community. These appropriations are up approximately $1.4 million in 2013. Office for the Aging, the appropriations here are down slightly by about $400,000. Predominant reason for the decrease in the appropriation at this point in time is grant funding. There will be grants that are recognized by this body or accepted by this body as we go throughout the year that will increase that dollar amount. Again, remember the 2012 amended budget includes the grants that have been accepted by this body throughout this year. Office of Mental Health, approximately a $1 million increase here, and this is to provide prevention and treatment of mental illnesses. The $1 million increase will be to provide services to, I just drew a blank on what I want to use there for a word, to provide services to individuals throughout the community needing services through the Office of Mental Health. In the area of public health, we're down approximately $3 million, about $2.8 million from last year. Again, public health area is made up of 6 different programs: special children's services, communicable disease prevention and control, administration, environmental health, medical examiner, and maternal child health. Predominant reason for the decrease in appropriations here deals with the special children's services. What we've realized, and again, as we do this budget every year, we fine-tune our estimates as to what we're going to need to provide appropriations for. We've noticed a slight decrease in not only the cost per case with these children, but also the case load of these children, so the number of people receiving the services. And we build upon that estimate of what we're actually seeing this year to produce a budget for 2013. The last area of my presentation for this evening is Monroe Community Hospital. Appropriations here are up approximately $1 million. This is an area that is part of the non-mandate or user fee supported. Two areas of increase here as far as the appropriations go. $500,000 in debt service costs, as we've talked about in previous committees. The 2004 refinancing that the county went through to save debt service dollars fluctuates between departments as to who gets hit and who doesn't get hit from year to year regarding debt service increases and decreases. The hospital received an increase of approximately $500,000 for that, and the additional increases regarding employee benefits for the hospital of approximately $500,000. With that, Chairwoman Draw, that concludes my presentation, and as soon as I get back over to the table, I'd be more than willing to take any questions that your committee members may have. Thank you.
We saved the best for last on that. Very nice. Okay, so at this time, Mr. Adair will take some questions from our committee. I would like to just remind all committee members that please, please, just ask questions that only pertain to the 2013 proposed budget, the Human Services budget at this time. Okay, thank you. And now we'll take, is there anyone with any questions? Legislator Andrews.
Thank you, Chairwoman, and thank you, Mr. Adair and the entire team, and for presenting the budget, and Commissioner Reed for entertaining questions this evening. I appreciate your time and effort that went into it. Just first, just a couple questions to start off with. The Medicaid, as you mentioned, obviously it's a first year since participating in the swap that we'll be switching to the hard cap. And in the presentation you mentioned in 2012, I think you called it the $123 million amount that went to our sharing partners. But I'm trying to figure out a way to compare the county's Medicaid costs from 2012 to 2013. I believe in last year's budget you projected the county would spend $167.9 million under the intercept for 2012. At this point in time, what would you expect that dollar to be?
Through the chair?
Through the chair.
Thank you.
Through the chair, can you clarify? I guess I'm not following which year you're looking for at this point in time. And I'm not even sure I have an answer for that right now, but we can get it to you. But if you could just be.
Thanks. Through the chair, I'm just trying to find a number that actually compares to what the hard cap payment will be for 2013, but in 2012. Sorry, I must not be being clear from that look I'm getting.
No.
Because the budget in 2012, we just had the figure for the swap, and in the 2012 budget, it was estimated that $167.9 million would be intercepted by the state for the Medicaid payment. I'd just like to know what that figure is now for 2012, because I think 167.9 is probably low at this point in time for this year.
Through the chair, based on the receipt of sales tax, you're correct. The number is lower than what we projected Medicaid expenses to be. Off the top of my head, I do not know right now what that dollar amount is. I do know that we are still below what our capped dollar amount would be based on our projections. And if memory serves me correctly, I want to say we were in the neighborhood of $3 to $4 million below what the true cap would have been had we gone under the hard cap. But I will have to get you the details on that.
Okay, thank you. And just to clarify through the chair, then, what I'm really interested in is being able to compare how much we'll spend for Medicaid next year with how much we're going to pay this year, whether it's under the intercept or under the hard cap, just so we can compare apples to apples, if that helps when you produce that figure.
Through the chair, I believe we can provide that, yes.
All right.
Any more
Yeah,
questions?
thank
Okay,
you.
Thank you, sure.
Through the chair, then, what would you project the Medicaid cost to be through 2014?
Through the chair, through 2014, we would add an additional 1% to the $183 million as far as what the capped number will be from the state.
Okay, thank you. Moving on, I guess, to the child care area through the chair. The number of children receiving services in our child care program continues to drop. Can you tell me at this point in time what's the projected average for 2012 for all the child care programs?
Through the chair, the question was what we project for 2013?
2012.
2012. The projection for 2012 is approximately 7,165.
And then the budget indicates through the chair that for 2013 you're projecting 250 more than that. Is that accurate?
Through the chair, that is correct.
Thank you. And can I request at this point in time the updated chart with the 5 programs broken out for 2012 year to date?
Through the chair, I'm getting some head nods from the director, but Bob Franklin's not providing me that same affirmative action. But yes, we can provide that spreadsheet, yes.
Thanks. Through the chair, and then I just would ask for clarification about the statement that was made about the facilitated enrollment program. How much do we expect to roll over, and what does that mean for next year?
The chair, my understanding is there is an anticipation that it could be in the neighborhood of $500,000. My understanding is that we do need state approval to be able to roll those dollars into 2013, which we have not received at this point in time, and it will be up to the state to make that decision.
Thank you. At this point in time, what's the timeline then for that decision to be made?
Through the chair, I'm being told that we would anticipate that as a affirmative from the state within probably the next 4 to 6 weeks. Actually, I shouldn't say 4 to 6 weeks. I should say by the end of January. I apologize. I'm thinking it's the middle of December.
Thank you. And through the chair, then, if we don't get permission by the end of January, what will happen? Will we lose that $500,000?
Through the chair, if we don't get approval from the state to do that, that is what would happen to those dollars, yes. I don't necessarily know that. I think we're anticipating an end of January timeframe, but I don't necessarily know that we can say with any affirmative action today that that would be by the end of January. It could be in February. It depends on the state at this point in time.
Thank you. Could I just request that when you receive that information that you share it with this committee?
Through the chair, certainly.
At this point in time for child care, which programs are closed to new applicants?
Through the chair.
Through the chair.
Through the chair, just facilitated enrollment.
Any other questions?
Yeah.
More?
Thank
Okay,
you.
Sure.
Through the chair, then, aside from facilitated enrollment, is there any rollover dollars in any of the other child care programs from 2012 going into 2013?
Through the chair, the answer to that is Chair, I apologize. It's potentially for up to $400,000.
And through the chair, in which program would that be?
Through the chair, that is the child care block grant dollars.
And what's our expectation for what we'll do with that money then? Can it be used next year through the chair?
Through the chair, that would be rolled over into 2013 and fully expended by September 30th of next year.
Thank you. Through the chair, does this budget project the eligibility level to stay at 165%?
Through the chair, that is correct, yes.
For the entire year?
Through the chair, that is correct.
And through the chair, just a couple other questions regarding the criteria for the program. I'll ask them all together. Do you expect the parent contribution rate to stay the same, as well as maintaining the quality differential? Will providers be paid the same as they are this year? And is there any sort of market rate increase projected for 2013?
Through the chair, it's yes to everything with a market rate increase of 2% October 1st.
Thank you. And we're going to go then the budget anticipates increasing the 2% in October.
Through the chair, that is correct, yes.
I think a couple other questions about childcare. Has the policy, or could you just refresh my memory, what the policy is regarding attendance at school? If a recipient is in college, a 4-year college or a 2-year college, are they still eligible for childcare subsidies?
Through the chair.
Through the chair. Thank you.
Madam Chair, if a daycare recipient is in an approved degree program, we can provide a subsidy so long as the applicant is also in an improved employment activity, such as a vocational education program or, in all reality, employment, part-time employment.
Thank you. Then, through the chair, from that answer, can I assume that if they're not also enrolled in...
Is that, Legislator Andrews, I don't believe that, where in the budget is that, we're talking about the proposed 2013 budget, and I believe that that's...
Well, it's actually, it's another criteria, I mean, that
think
defines eligibility for childcare that is pertinent to the budget, because if that were to change, then it would affect who would be eligible for childcare, which is thoroughly what we're discussing at this point in time.
Okay, let's just ask the questions that pertain to the budget right now.
It does pertain to the budget. And I just want to follow up on what he said, because I wanted to clarify that I'm assuming then if a recipient of child care is enrolled in college but not working at least part-time, then they're not eligible. Is that correct?
Madam Chairwoman, that is correct, and I will clarify that what we're talking about is a vocational program or a 2-year program. Generally speaking, Monroe County does not approve 4-year degree programs or master's degree programs.
Thank you. A couple other questions in a different area, please. On page 136, under the Department accomplishments for 2012, under the financial assistance area, it talks about moving this past year to centralized management of public assistance work experience program placements by way of a single contract with Rochester Works. I wanted to ask how that transition occurred this year, how it's going, and then what is the work participation percentage rate for WEP placements now?
Through the chair.
Through the chair.
Thank you.
Through you, Madam Chair, the centralized WEP management program went very smoothly in the transition to Rochester Works, and we've been very successful with our placement rates. Starting in July, they placed at 92%, and by October they were placing at 99%, with an average day from referral to placement of 7 days.
Just to clarify through the chair, is that they placed 92 or 99% of everyone referred there?
Everyone referred there.
And so, okay. And is there a percentage rate that's required by the state, participation rate that is required?
Through the chair, its requirement of the state is 30 hours per week.
Okay, thank you. Another area regarding child abuse reports, we've talked about this over the past few years and the troubling increase in the number of reports that we continue to see each year. And I know that you've indicated before that you think it's from increased awareness and increased reporting. Do you have any new information at this point in time to provide, or any sort of plan to address in 2013 this continuing increase in number of children?
Where is this pertaining into the budget?
It's on page 143, through the chair.
The question you're asking is about the funding?
No, my question I'm asking is about the problem and how the budget anticipates addressing the problem.
I don't see that that's, I think that's a separate question that you can ask later. We're talking about the funding through it. If you have a question about the funding and the budget.
Chairwoman Draw, the budget is far more than just funding.
It
It is a
is.
statement of
What-
priorities for
can
this
you-
county.
Would you ask your question again?
I've asked this question every year because it's important to me. And so I'll
Where-
ask it again.
Sure.
The question is, on page 143, you'll see every year there's an increased number of child abuse reports that are filed.
Yes.
Physical abuse, maltreatment, and sexual abuse. And our county has responsibility for addressing this, and we spend money on programs that are supposed to be combating child abuse to decrease these numbers. And so we've talked before about trends and increased reporting in our community and in others across the country. And so my question really is, what does the 2013 budget anticipate or plan for continuing to combat the increasing number of children that are about these reports?
Okay.
Through you.
Thank you. Yes, you can answer that question. Thank you.
Through you, Madam Chair, you know, in the past when we've discussed this, it's hard to know exactly what goes on when there's an increase, and we've discussed that locally we're experiencing a trend that is actually common across the United States in terms of an increase, and I know that you just referred to it as an alarming increase. I think we have to be very conscientious when we speak about the number of reports that are filed and what we are finding in those cases. At this point, I can tell you that the actual number of physical abuse cases that were investigated in the 2011 year, there were 92, and year to date, for the 2012 year, it's 65. Reports of maltreatment in the 2011 year actual was 7,543, and year to date in 2012, it's 6,273. Reports of sexual abuse were 469 in 2011, and 491 year to date for 2012. One of the things that's really important to remember about the Department of Social Services is that we do two things. One is, with regard to the statistics you're asking, is we respond to the reports that are sent to us for investigation. The other thing we do is we work with the community around preventive issues so that we can try to address those issues, like, for instance, through Building Healthy Children, which is included in this grant, through Nurse Family Partnership, which is a part of the Health Department's grant, as well as several other preventive programs. In addition, this year, we participated with and are pleased to be a member of the group that has introduced Darkness to Light, which is the child sexual abuse campaign that the Bavona Child Advocacy Center will be implementing for this year. So when we talk about reports from the community, one of the issues is when you have a particularly aware community and when you encourage that awareness, like in Darkness to Light, I'm going to anticipate that we're going to see an increase in the number of child sexual abuse reports that we see. I would be tremendously hesitant to say to you that that's a result of increases in sex abuse cases, the occurrence of sex abuse. I would say to you that that's an increase in the public's awareness and commitment to reporting it. That's where we need to be careful about how we define it.
Thank you. Thank you, Commissioner Reed.
Thank you,
Any other
Commissioner. I appreciate the response, and I'm glad to hear the year-to-date numbers as well. And it'll be an area that we can continue to talk about. I appreciate that very much. Thank you. Related to this is the purchase of service contracts. It appears that there's an increase this year of $1.2 or $3 million. Through the chair, what's causing that increase, or what's the new contract?
Through the chair, the primary increase to those contracts is under the COPS funding, and they are increases to the Hillside Work Scholarship Program by approximately $400,000, Encompass Resources by approximately $400,000, and the Building Healthy Children's Program by about $400,000.
Thank you. Is that all of the COPS funding in the 2013 budget through the chair?
Through the chair, that is correct, yes.
Thank you. And now those programs, Hillside and Encompass at least, lost money in last year's budget. Is that correct in this area? Through the chair.
Through the chair, I'm sorry, there was another conversation going on here. Could you repeat the question?
If I recall correctly, I think that Hillside and Encompass lost funding in the 2012 budget. Is this a restoration of those same amounts? I don't recall exactly how much they were, or is this reduced funding?
Through the chair, it's not, it's improved from 2012's appropriation, what was provided to them, but it's not a full restoration.
Thank you very much. And could I request a list then of the full purchase of service contracts for 2012 and 2013?
Through the chair, certainly.
Thank you. And also, when you provide that, could you break down what percentage of that funding goes to evidence-based programs for me, please?
Through the chair. Through the chair, if we have in the past, we will provide that again, yes.
Thank you. Also on that page, I think that's page 164, there's an area of miscellaneous revenue. It's an increase to $1.4 million. Through the chair, could you explain what that is?
Through the chair, that would be the donations portion of the COPS program.
Thank you. Moving on to the Youth Bureau. I know there's some changes occurring on the Youth Bureau. Under the objectives, I guess it states there's a merger between the Youth Bureau and the Office of Aging. Through the chair, could you explain what's going to happen there in 2013?
Through you, Madam Chair. Yes, we are creating in the 2013 year, we are creating the Office of Intergenerational Supports, which allows us to capitalize on the intergenerational events that County Executive Brooks created that include a variety of different opportunities for young people and our aging population to interact with each other and learn from each other. In addition, in merging those two, we are going to change actually the title of the Youth Bureau to the Office of Youth Development, which will enable us to consider other opportunities for funding for the programs that funnel through the Youth Bureau. Youth Bureau will continue to exist because it is an actual entity that's created by the state of New York, but 80% of the funding that comes to our local community from New York State for youth bureaus has been cut. And so we made a proactive decision to allow the opportunity for us to expand opportunities for youth by creating the Office of Youth Development and also by merging the two departments together to allow for staff efficiencies and more opportunity to capitalize on the positive youth development and our aging population's positive development as well through the work that we're doing there.
Thank you. Kind of look forward to seeing how that proceeds, bringing together two different parts of the age spectrum. Currently, how is that, you mentioned the staffing efficiencies, how is that going to work from a staffing perspective? I believe there's a director of the Youth Bureau, there's a director of the Office of Aging. Will there continue to be two directors, or is there going to be one director to oversee the whole new division? Through the chair.
With all due respect for you, that does not sound like a fiscal matter. It's more of a programmatic, operational issue.
I would agree. I was going to just actually ask the same thing. I think we could talk about that at a later time.
Actually, Chairwoman, if I thought about it ahead of time, I would have just looked it up, but I believe all the staffing stuff's in the back of the budget, so there is a breakdown of FTEs per department, so if perhaps they could answer the question. I'm sure it's in some page here. I just don't know.
Is that what you're,
what the FTEs are actually doing.
I want to know what it's going to look like.
In the
The Commissioner
deposit?
mentions,
Commissioner Reed, could you briefly tell us what that's going to look like?
Through you, Madam Chair. It's actually for the Office for the Aging and for the Youth Bureau, there's a requirement to have a director in both places, so they will continue to have directors with primary oversight being provided by one.
Thank you.
thank you very much. Also in the area of the youth bureaus, could I request a list of the agency contracts by agency amount for 2012 and 2013 through the chair? It looks like there's going to be cuts to the agency contracts. I'm not sure if that's because of the change in the two departments or not, but if is it possible to receive that list?
Through the chair, we can provide that list.
Thank you. Do you know offhand which agency is getting cut for funding for 2013?
Through the chair.
Through the chair.
Thank you.
Through the chair, we believe it's CCSI, but we will confirm that when we provide you the list.
Thank you. And lastly, for now, in this similar area with the Runaway and Homeless Youth Program, agency contracts are dropping here as well from $250,000 down to $150,000. I think this is on top of a cut from last year. Do you know what's being cut and why and how programs will be affected, please, through the chair?
Thank you.
Through the chair, the why on the question is because of funding reductions from the state regarding those cuts. The program or the agency that will be impacted by that, again, is CCSI.
Thank you very much. That's all I have for right now.
Thank you. Well, this is the questions that pertain to budget right now and tonight. We're not going to go back to them after we close the questions.
Well, Legislator Cayley wants to ask
Okay,
some questions. I'm
that's-
sure
I
I'll
was-
have a
you
few
said-
more after.
Okay, fine, thank you. Legislator Cayley.
Thank you. Thank you for the opportunity. I've lost my place, actually. This is a long committee. But moving on to something slightly different, if I may, through the chair. In the objectives under Human Services, one of the objectives listed is a centralized document management system to address longstanding problem of misplaced paperwork in the department. With the amount that would be budgeted for this particular activity, will the work be done concurrently to account for past misplaced paperwork as well as securing the paperwork coming in from day one?
Through the chair.
I said that first.
Oh, you did, I'm
I did.
sorry, thank you.
Long question, sorry.
Thank you. Just reminding you, in case. Thank you.
Through the chair, if we understand the question correctly, this project will be a date-forward project and not a backdated project, so it will be from the most recent recertification that the individual went through, that we will then provide that document management from that point forward. Anything from a prior file will not be part of this particular initiative.
Thank you. Well, just a point of comment. If I understand correctly through the chair, then anyone's case work going forward would then be certified from that day one, going forward?
The Chair, if I understand the question correctly, if you were to come in tomorrow to be recertified, it would be part of that project. If you were to come in 6 months from now to be recertified, it would be part of that project from that date going forward. So it's upon the most recent recertification that you have.
Thank you. And then within this project, thank you through the chair, then is there a plan in place to secure the, is there a place in the budget that would allow for the work being done to secure the past contracts or service provided to bring them up to standards? Not easy to describe this, thank you, through the chair. In other words, we have a whole bunch of people out there that would have already been previously certified that would not be a part of this project or what's budgeted for this project. And my concern is what is happening to the pre-certified cases in bringing them into the new program. Is this appropriated?
Through the chair, I do agree that this is a difficult, probably a miscommunication regarding the answer and the question. So bear with us as we try to address what we believe is the question that's being presented to us. Cases are image scanned today. I don't know how, off the top of my head, it's here, there, and everywhere as far as those case files being imaged today. This project will anticipate moving forward to making sure that all of the cases are part of this document management system. There's no budgetary appropriation provided for any of those old cases that have not been image scanned or any way, shape, or form otherwise documented from an electronic media standpoint.
Thank you. I think I understand. So, but if the case is still open, you will begin to scan those under this project.
Through the chair, just as a point of clarification, if a case is open today, there is a possibility that it's already been scanned. So I don't want you to leave here thinking that there's absolutely no chance that an old document doesn't exist. But going forward, it will absolutely go through this process, yes.
Thank you. Thank you. That made it much simpler. I have a couple more. Coming back up to the, if I may, through the chair, with the intergenerational division that's being instituted. It's projected that it would make it easier to apply for grants or available for grant money coming in because of the way that this division is being handled. What would be the effect if the grant money is not there going through only this budget year? I'm not asking for a projection of any farther than that, but would you be able to maintain this program with the current budget if the grant opportunities were not there?
Through the chair, this plan was put together to be sustainable in hopes that we can continue to receive additional grant funding to offset any additional costs as we move forward or to provide additional or new services. So the answer to that question is a simple yes.
Thank you. All right. Okay. Moving forward, through the chair, the summary of authorized positions for human services, which is on page 53, allots for 975 positions in the department. But when you go to page 762, this was added up for me, and it appears that the listings are actually over 1,000. Is there a reason that there's a discrepancy that I'm not familiar with?
Through the chair, that is the difference that you're seeing is the funded full-time equivalents versus the authorized positions.
So then clarify then the funded positions are the 975?
Through the chair, that is correct,
Thank
yes.
You. And then, through the chair, following up on that, is there ever a possibility within this budget that those non-funded positions would be staffed?
Through the chair, absolutely, there is that possibility, yes.
All right, then let me ask, follow up on that, then how?
The chair is, as you probably realize, in any business, you have people that leave throughout the year, and subsequently a position that somebody may be fit for from a civil service requirement may fit into a different job title more effectively than a previous job title. So the duties, responsibilities could change from various positions, but the funding from the position that was left would then be provided to the new position that we are using that is an authorized position at this point in time.
All right, thank you. Moving on to page 539, if I may, through the chair. The Central Administration Division, their professional service appropriations going from $450 in 2011 to $100,000 in 2013. Can I have an explanation for that, please? Page 539. It took me a minute. Thank you, through the chair.
Legislator Kaylee, can you repeat that page?
Page 539.
39, okay.
Line 504320.
Through the chair, when we get into these details, it may take us a little bit longer to get through those. What that is another contract, and I don't have the specific contract, was moved there from another division inside of Human Services in a prior year. So that $100,000 appropriation existed in one of the other divisions within inside of Human Services. The specific contract, we can provide that to you. We don't have that right now, though.
Thank you, I appreciate that. Over at the, through the chair, with respects to the community hospital, looking at charges to other counties have dropped just under 10 million in 2011, from just under 10 million to 6.7 in 2012 and 13. Is there an explanation for the drop in the charges to other counties?
Through the chair, I believe you're referring to charges to other governments and not charges to other counties. Is that correct?
Probably, yes.
Okay.
Through the chair.
That is I referred to it in the presentation, the intergovernmental transfer program with the state and the federal government. And effectively, it allows us to provide funding from the county to draw down additional federal dollars. It's a program that the state and the federal government have worked on for years. And effectively, in 2011, we were able to provide additional funding because of the increased FMAP percentage that we were receiving in reimbursement, which allowed us to draw down more federal funds than were available. At this point in time, what we've done is we've projected what the 2012 and 2013 dollar amount will be, and I believe the 2012 dollar amount is accurate as it is stated here, and the 2013 dollar amount is what we've budgeted to draw down in IGT funds for 2013. That could change depending on the formula with the state and federal government, but this is a revenue that's used to, that our appropriation is used to support an additional drawdown of federal dollars from that point forward.
Right, thank you.
Any other questions, Legislator Kaylee?
I'm going to take a break. Thank you.
Okay. Is there any other questions for Mr. Adair? Legislator Andrews.
Thank you. Thank you. Just wanted to follow up on Legislator Kaylee's question regarding the discrepancy in the positions, just to make sure I understand this correctly. On page 53, those 975, those are the funded positions, and then the positions in the back of the book are authorized but unfunded positions. Is that correct, through the chair?
Through the chair, that is correct, yes.
Thank you. So then is that similar with other departments as well, that all the positions in the back of the book, if there's a discrepancy, those are unfunded but authorized positions?
Through the chair, to the best of my knowledge at this point in time, yes, that is correct.
Thank you. What would be the rationale through the chair of keeping, like in this situation, 57 authorized but unfunded positions?
Through the chair, as I had mentioned in my answer to Legislator Cayley, it allows the department flexibility regarding staffing as they move forward, and when people leave or retire mid-year, it allows the opportunity to be able for a department head to reassess the functions that are necessary and be able to provide an adequate resource from a personnel standpoint as they move forward throughout the year.
Thank you. Sorry I missed that answer. That's on me. Through the chair, just one last question in that area then. Is there a list of the funded vacancies somewhere in the budget, through the chair, for the Human Services Department as well as other departments?
Through the chair, I'm not sure I understand the question.
I guess I ask it because with the announcement of the budget, there's usually a proclamation of we've cut X number of vacancies resulting in X million dollars of savings, but they're not inhabited positions. So fewer people lose their jobs than the amount of positions that are cut. And so my question is, where are those vacancies listed? I mean, if they're cut, they must be funded. I mean, if they result in savings.
Through the chair, I'm not. When we refer to this issue and when we present the budget, it's dealing with what we projected in the, for instance, last year, what we projected our cost to be for 2013. So when we eliminate positions, it's because those positions were funded at that point in time for 2013, so for the subsequent fiscal year. So I think there's sort of this, and this is a constant issue that I think we deal with, is people think that we're sort of mixing apples and oranges here, and what we're really talking about is the fact that we've projected a certain level of appropriations to be provided in subsequent years. The elimination of those positions in this particular budget, which I believe was 20 positions in total, 2.5 layoffs, and 17.5 eliminated vacant positions, was part of what we had projected in our 2013 deficit. Because if you recall, in every press release that we've ever put out about the budget, it's about how we closed the gap that what we projected from the previous fiscal year. If that makes any sense to anybody. I'm not sure it even did to me at this point in time.
Well, I can't say 100% yes that I understand that, but I think I get more towards what you're talking about than how I'd been envisioning the funded positions. So thank you for that, and we certainly may follow up later to get further clarification. A couple other questions here going to the caseload projections that are built into the budget. I think historically, the caseload projections in most of our social service programs are lower than what the actuals turn out to be year to year. And so how does that happen? And why are we confident, again, with the caseload projections that we have in the 2013 budget if, at least for the past few years, all of those projections have been too low, through the chair?
Yes.
Through the chair, I guess I would ask for clarification as to saying that the caseloads have all been too low. I don't understand that statement.
Through the chair, the caseload projections have been lower than what the actuals have come in at. So, for example, if you look at page 147, we had estimated in the 2012 budget, the estimate for the safety net caseload was 7,617, and now the estimate for the same year is 7,874. And the estimate for the Medicaid caseload had been 80,000, but it's coming in higher than 80,000 for this year. And the same for food stamps and then the home care unit. And I've noticed that trend over the past few years. The numbers that we project are lower than what the actuals come in at. And since those caseload projections drive the budget, I wonder how that works throughout the course of the year.
Through the chair.
Through the chair, of course.
Thank you.
Just to clarify, sorry, the numbers I read initially, the estimates for 2012 are not printed on that page, but they were printed on for 2012's budget last year as what we expected the caseloads to be throughout the year, and I assume that's what you then build the budget on.
Through the chair, I think I'm following the question now, and talk about what we talked about in the presentation. I think in some instances we see actual caseload reductions in the area of family assistance in particular, where we're estimating 2012's number to be 6746. We actually projected that to be 6950 last year. So we're seeing a caseload reduction there. So in making the statement that we're always too high or too low regarding our caseloads is not a true statement from that standpoint. In the case of safety net, what we're seeing there, while our caseload projection was off, so 7,600 approximately for last year, and we're estimating it to be 7,874 at this point in time, what we've seen is a dramatic cost drop in that cost per caseload, which has allowed us to then go back and re-look at our model as far as calculating the appropriations that we'll need for that program, and then based on that model is what we've projected for in this particular budget.
Okay, thank you. And so, I mean, you must obviously be comfortable with the projections that you make. I mean, I would say this is the first year where the family assistance projection was over from at least the past few years that I've been reviewing it. Historically, you have under-projected those caseloads. But I would certainly agree with you that this year the family assistance was over.
Through the chair, I'm very confident in these numbers that are in this budget book. I wouldn't have it presented to you, nor would the county executive if we weren't.
Thank you.
Any other questions?
I do have a few more, yeah. I guess I'd like to explore a little bit the Medicaid caseload with you through the chair, which seems to still be substantially increasing year to year, and perhaps that was against the trend of some of the others that are perhaps trending back downward now. What would you think would cause that increase still in the Medicaid caseload through the chair?
Through the chair, what we understand to be a very aggressive marketing campaign by the state for this particular program is driving the numbers as far as the enrollees up at this point in time.
Would you mind expanding on that a little bit? What's the state marketing campaign through the chair?
No. Legislator, I think we want to just stick to what's in the budget. And as far as the campaign, you can ask that question in a separate, if you'd like to put it in a writing and ask about that program. We'll just stick to the questions in the budget, okay? Thank you.
Is it easier to put it in writing or just answer it at this point in time?
Through the chair, if you would entertain me for 1 second to hopefully alleviate having to write the answer out, I would appreciate that. Thank you. On the state's website, they actually market the Medicaid program as a health insurance program and not a social services program any longer. And we believe that is an effective marketing ploy by the state in order to drive people towards this program. And that is what's driving the caseload numbers up.
Thank you very much.
Thank you, Chairwoman Draw.
Thank you.
Through the chair, and with safety net, in the past few years, there have been a couple of increases with the basic grant component, and the state's covered some of the county's share of those increases. My question is, at this point in time, it appears from reading the synopsis on page 154 that those increases have changed, or have stopped. So at this point going forward, what is the percentage the state pays and what is the percentage that the county pays for safety net?
Through the chair, if I'm understanding the question correctly, it's a 71% county portion and 29% state portion for the program.
Thank you. Through the chair, going now to the juvenile justice figures on page 143, the 2012 estimates appear very low compared to, I guess, what we would expect them to be. My question is just why are they so low?
Through you, Madam Chair, you're asking, the question you're asking is why the numbers have dropped? Is that?
That wasn't the question I was asking, actually. I think I asked the wrong question in that area. I know you've had some successes in this area, so that's nice to see. Thank you.
Yes.
Yeah, no, I misread my notes. Sorry about that. Just a couple other questions regarding the maternal child health area, moving on to the health department. Could you just explain the change that's going to happen this year? Under the department objectives on page 226, there's a bullet point that talks about the state assuming responsibility for entering into contracts with counties as they assume responsibility of the fiscal administration of EI programs. What's that mean, and how will it affect us in the delivery of these services?
Through the chair.
Through the chair, it should not impact the delivery of services whatsoever. I think if you remember correctly, during the state budget announcement for 2012-2013, they announced some mandate relief to counties regarding a quote-unquote fiscal agent for this particular program, where the state would handle all of the contracting and thus bill payment process for these programs.
Through the chair, so you don't expect it to affect the services or the programs themselves at all?
Through the chair, no, that would not be our anticipation. If there is an impact, that would be a question to the state to deal with at this point in time based on their takeover of that processing.
Thank you. On page 233, why is the net county support for maternal child health increase from $723,000 in 2011 to $1.46 million in 2013?
Through the chair.
Through the chair.
Thank you.
Chair, I apologize. We were trying to flip to the page number. Can you repeat the question?
Why is net county support increase for maternal child health?
Through the chair, that would be due to the grant funding reduction at this point in time.
Thank you. So the county's picking up more of that share of those costs?
The chair, that is correct.
Thanks. In the same area about Nurse Family Partnership Program, how much is that program funded for 2013?
Through the chair.
Through the chair.
Through the chair, we believe it's the 1.1 million, the grant funds that are there listed on that particular page, but we will get confirmation of that specifically.
Thank you. Could you also, when you confirm that that's either the same, or let me know what it was funded at in 2012 through the chair?
It is my understanding that is a slight increase from 2012, but we will confirm that.
Thank you. A couple other questions about Nurse Family Partnership. What would be the number of families that we would expect to be served under that program in 2013?
Through the chair.
Through the chair.
The chair, that number would be 335.
Great, thank you. And how much of that 1.1 million would be county support, local county dollars?
Through the chair.
Through the chair.
Thank
Through
you.
the chair, I'll have to get back to you on that. I don't have that off the top of my head here.
Thank you. Now, if I recall correctly, earlier in the year, we had conversations regarding nurse-family partnership and some of the costs being paid for through Medicaid, I believe it was. If that's true, I think that was money that we were expecting to come in during 2012. Was that money dedicated to nurse-family partnership? And did it, if we think that there's just a slight increase from 2012 to 2013 for nurse-family partnership, why wouldn't we have seen more of an increase with more funds coming in through Medicaid?
Through the chair, please, Legislator Anders.
Through the chair.
Thank you.
Through the chair, I'm going to have to ask you to rephrase that question somehow because I have no idea what you're asking for right now.
Sure. Maybe I'll just start with, isn't there some Medicaid funding through the chair that's available for nurse-family partnership now and built into this 2013 budget?
Through the chair, yes, there is.
And how much would that be? Through the chair.
Through the chair, that amount is approximately $150,000.
Thank you. For the Building Healthy Children, is the funding at the same level for 2013 as 2012 through the chair?
Through the chair, it is a slight increase from last year. It's to compensate for lost state funds for that program.
Thank you. In the area of special children's services, you may have touched on this in your presentation. I just want to confirm. It appears that the cost for special children's services is dropping $1.5 million, and actual services and benefits are dropping $1.1 million. My question is just why?
The chair, we did.
Through the chair.
Through the chair, as we did discuss in the presentation briefly, that is a combination of two things. It's a lower cost per case, as well as a reduced number of children being served through that program.
Thank you. And could I request at this point in time then the number of children who receive services broken down by the EI and preschool education program for 2012 and 2013? Through the chair.
Through the chair, it's $1,400 for EI and $1,800 for preschool.
Okay. I think the last year in 2012, you estimated it was going to be $3,100 for those two programs. So if this is projected to be $3,200, then that would look like an increase through the chair. Is that right?
Through the chair, I'm getting a nod, yes.
And maybe I'm not following these programs, but didn't you state that there's going to be a decrease in the number of children receiving services, and yet there's a projected increase?
I think what we're doing is mixing what the actuals are versus what the budgeted numbers are. What we're seeing today is an actual number less than what we had budgeted for last year. We've subsequently made the budget appropriately higher for what we're actually seeing today in actual cases. So it could actually be, from a budget perspective, it could actually be higher with the cost being lower. But the reality of it is there is a slight growth factor that we use historically in these programs in order to determine what the appropriation to be provided is.
Okay. Thank you very much.
Thank you. Any more questions?
I don't have any more questions at this point. Thank you. I appreciate everyone's time and energy in answering the questions this evening.
Legislator Kaylee, you have another question? Okay.
Anybody have WD-40? Yes, thank you. Through the chair, just one question, and then I'll fade into the sunset here. On page 583 of Public Health, Environmental Health, agency contracts, and this may have been answered partially about 20 minutes ago. Agency contracts have gone from 1,012,000 in 11 to 305,000 in 12, and nothing in 2013. As I said, through the chair, this may have been explained briefly, but I would need it to be explained again.
Through the chair, we believe that that's a grant, but we'll have to confirm that and get back to you. And that's the reason why there is nothing budgeted for at this particular point in time. But as soon as a grant is accepted, if it is, we would then put that into the amended budget.
Thank you.
Legislator Kaylee, can I just remind everyone, through the chair, and then ask your question, please? Thank you.
Excuse me. I've been saying through the chair all night long. Now, you didn't let me even say it. So, through the chair.
Thank you. Thank you.
I have a point of order, Madam Chair.
Yes.
Point of order. Okay, it has been the customary procedure of this body in this room to always address through the chair as the first opening statement of any questioning that goes through into the administration or anyone else. Could we please just stay with that? Is that it's very simply just through the chair and then state your question.
Yes.
That's all it is.
Thank you.
To the point of order, actually, I've been in this chamber for a few years too, and I agree that we certainly use through the chair, but I also would state that some people put it at the beginning of their statement, some people in the middle, and some people at the end. I don't think you can characterize it as always being at the beginning of a statement.
For the rest of this evening, how about we just, through the chair, and then ask our question? Thank you. Legislator Kaylee, do you have any more questions?
Through the chair. Yes, I do.
Thank you.
Just one briefly on what we just spoke about. With that small report in writing, since it does state agency contracts in plural, and you believe that it could be grants that haven't been received yet, could you at least outline what grants might be impacted if the funding does not come in? That is all. Thank you.
Thank you.
Through the chair, we certainly can do that.
Thank you. Any other questions? Legislator Valerio.
For a later discussion or report, I would love...
Through the chair?
Through the chair. Sorry.
Thank you.
Thank you. Anyway, through the chair. I just want to say this for later. The narrative that talks about the accomplishments, I would love to see a report at a later date regarding the impact of the training that was done for the staff, and regarding the Fatherhood Initiative and how that has impacted our savings and also the health of the family in the county. Later time, not now. Thanks.
Thank you. Thank you, Legislator. Any other questions pertaining to this budget? Seeing none, I would again like to thank Scott Adair for answering all those questions, also Commissioner Reed and Mr. Franklin and for the presentation and question answering to this committee. Now, the approval of minutes is the next item on the agenda. You have before you the October 22nd. They will stand approved unless the clerk is notified by any changes by the end of the day. And next item on the business is new business, Madam Clerk.
Referral 12-328,
By
authorized.
Legislator Quattro, second by Legislator Daniele. Is there any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-329.
Moved by Legislator Daniele, second by Legislator Ansello. Any discussion on this? Legislator Andrews.
Thank you. Through the chair. Could I request copies of the material that is on file in the clerk's office for this referral, please? As well as my question is this references a new allocation, the Federal Substance Abuse and Mental Health Services Administration grant that just came in. My question is if that grant is also going to be funding other activities, or is it just exclusively for this program? Through the chair. Oops, I already said it.
Through the chair, I'm Dr. Kathleen Plum, Director of the Monroe County Office of Mental Health. In regard to the first question, that was regarding the purchase of service binder that's in the clerk's office?
Yes, yes, please.
And Legislator Andrews, you can actually access it. I accessed it from the clerk's office myself, so you could have someone in your office access it for you.
Okay,
Thank
I'll do
you.
that, thanks.
Great. You can answer the second question, part of the question. Thank you.
Through the chair, the grant that was accepted last month by the legislature will fund activities related to expansion of systems of care for upstate New York.
Okay, thank you.
Thank you. Next, all those in favor signify by saying aye. Any opposed? Next item.
Referral 12-330.
Moved by Legislator Ansello, second by Legislator Michike. Is there any discussion on this? Legislator Andrews.
Thank you. I just wanted, through the chair, this referral is for the foods contract, food and vending management contract at MCH. I'm assuming by reading this that we are not contemplating any outsourcing of the food service workers at MCH at this point in time. Is that correct?
Through the chair, that is correct.
Thank you very much.
Any other discussion? All those in favor signify by saying aye. Any opposed? Next item.
Referral 12-331.
Moved by Legislator Ansello and seconded by Legislator Valerio. Is there any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next
Referral
item.
12-332.
Moved by Legislator Valerio and seconded by Legislator Quattro. Is there any discussion on this? All those in favor signify by saying aye. And any opposed? Item carries. Next item.
Referral 12-333.
Moved by Legislator Quattro, second by Legislator Daniele. Is there any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Next item.
Referral 12-334.
Moved by Legislator Daniele, second by Legislator Ansello. Is there any discussion on this? Legislator Cayley.
Thank you, Madam Chair.
I know, they're all falling apart.
All right. Through you, I would just ask for a brief explanation about the educational intervention that is done with in the schools. Am I on the right one? I'm sorry, it may be on the wrong one. Are we at 34, 35?
34 on the.
Oh, I'm sorry.
Okay.
Take that back.
Okay. Is there any other discussion on 334? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-335.
Moved by Legislator Ansello, second by Legislator Michike. Is there any discussion on this? This is it, right? Legislator Cayley? Fine.
Yes, it is. Thank you. Through the chair.
Sure.
It mentions existing positions to purchase educational promotional materials. No. A brief explanation of the educational intervention with children. Is this through the school system or is this through home visits?
Through you, Madam Chair, I'm not aware of any specific educational activities that target children in this. This is, the educational activities are for parents with regard to keeping their homes lead-free.
Okay. Any? Is that
Thank you. Through the chair, I guess I would say then that the language in the referral is a little bit misleading, being that it doesn't speak specifically to just dealing with parents of children with elevated blood levels. It speaks to children with elevated blood levels and their families. But I just wanted to point that out. Thank you.
Thank you. All those in favor signify by saying aye. Oh, I'm sorry, Legislator Andrews?
Thank you. Could I just request a copy of the most recent lead paint poisoning statistics, please, through the chair?
Thank you.
Madam Chair, yes, we'd be happy to provide that.
Thank you. Okay, then, any other discussion on this? All those in favor then signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-336.
Moved by Legislator Michike, second by Legislator Valerio. Is there any discussion on this? Legislator Andrews.
Thank you. How many times was Ontario and Durand Beach closed in 2012 through the chair?
Through you, Madam Chair, I don't have the exact numbers. It was a very dry season, and Durand Beach was open approximately 80% of the time and closed about 20% of the time. The beach at Lake Ontario was opened about 60% of the time and closed about 40% of the time.
Do we also monitor the Hamlin Beach, or is that not our responsibility? Through the chair.
Through the chair, that is not our responsibility. It's a state beach.
Thank you.
Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-337.
Moved by Legislator Valerio, seconded by Legislator Quattro. Is there any discussion? Legislator Cayley.
Thank you. Through the chair, I just have one question. As a result of this funding and the continuing screening and education on HIV, do you consider this to be successful in actually eliciting names from patients?
Through you, Madam Chair, in general, it's not very successful, as you can imagine. People, when confronted with requests for this kind of information, are likely to be very withholding. However, we do well compared to similar programs in other counties.
Thank you.
All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-338.
Moved by Legislator Quattro and second by Legislator Daniele. Is there any discussion? Legislator Andrews?
Thank you. Could I just request a number of families that...
Through the chair, please.
Oops, through the chair, that are in the Nurse Family Partnership Program for this year, as well as the Healthy Mom, Healthy Baby Program, please?
Through you, Madam Chair, I've mentioned before that the Nurse Family Partnership Program serves approximately 335 mothers. The Healthy Mom, Healthy Babies program is really sort of a systems improvement program and doesn't really serve a particular patient population. However, we do fund one Nurse Family Partnership nurse through this grant, and that nurse sees approximately 25 families per year.
Thank you for that. And I did ask that earlier. I was talking about 2013. I guess I had thought there was an increase for Nurse Family Partnership families.
Through you, Madam Chair, during the year 2012, we did add 2 additional nurses.
Okay, so there's not an additional increase for 2013. It's just a continuation of where we are at now through the chair.
Through the chair, yes, that's correct.
Thank you very much.
Thank you. All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-339.
Moved by Legislator Daniele and seconded by Legislator Ansello. Is there any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item,
Referral 12-340.
moved by legislator Ansello and seconded by legislator Michikay. Is there any discussion on this? Legislator Andrews.
Yes, I'd like to just get
Through
an
the chair.
explanation of
Thank
what
you.
you would see with a drug driving test with anybody who's on the, quote, the bath salts or synthetic marijuana, through the chair.
Through you, Madam Chair, I'm not confident that I know the answer to that question, and we'll get back to you with the answer.
Thank you.
Thank you. All those in favor signify by saying aye. Any opposed? Item carries. Next item,
Referral 12-341.
moved by legislator Ansello and seconded by legislator Valerio. Is there any discussion on this? All those in favor signify by saying aye. Any opposed? Item carries.
Referral 12-346.
Moved by legislator Valerio and seconded by legislator Quattro. Is there any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-365.
Moved by legislator Quattro and seconded by legislator Daniele. Is there any discussion on this? Seeing none, all those in favor signify by saying aye. And any opposed? Item carries. And that brings us to any unfinished business to come before this committee. Seeing none, there will be no further business. The next meeting of the Human Services Committee this meeting will stand adjourned, and the next meeting will be December 18th, 2012. Thank you. Have a nice evening.